Unpopular dental provider opinion. Okay, I'm a denturist. My name is Kismet, and I specialize in dentures and all removable non orthodontic dental appliances. And I think I've cracked the code of why there are so many unhappy denture patients on this platform. And I'm going to tell you what I think. So I see so many people on here saying their dentures are killing them, they're loose, they're not fitting properly. And I feel like I answer questions all day long and say, why haven't you gone back for adjustments? Have you had a permanent hard reline to tighten your dentures up and to stabilize them? And a lot of the times they're just like, well, no, I didn't know I needed to do that. Well, no, I didn't know. What is a permanent reline? What is a reline for that matter? And this is what I think. I think nobody's telling you. I think nobody's telling you when you get dentures that it's not a one and done thing. Like your mouth is changing forever and ever until the day you die. When you get your teeth extracted, it leaves big holes in your bone, and those holes have to close. And then your bone is remodeling, but it doesn't have that structure of the roots of those teeth to remodel around and hold its shape. So when you have your teeth extracted, your gums shrink, the uppers shrink up and back, the lowers shrink back and down, and it happens forever. There are things that will speed that along, and that is wearing loose dentures, putting a bunch of adhesive or thermoplastic products in there because a denture is still too big. And so it's moving around, just little micro movements even, and it's wearing your bone down. People are getting out their Dremels and they're adjusting sore spots on their dentures and they don't know what they're doing. And really, it's because the denture's too big because their gums have changed. So they're adjusting things, but that's not fixing how the denture is fitting. People are not getting replacement dentures. They're supposed to be replaced every 5 to 7 years. Not because they won't last longer than that. They will, but the teeth get worn down and the bone shrinks, and pretty soon your mouth is closing further than it should because your dentures are now too short for your mouth because your gums are small and the teeth are worn down. But here's the thing, nobody's telling the patients this, and I think I know why. Because it's a freaking hassle. It's a hassle for the provider. And you know what? Dentures, even though they're expensive, they're not big money for dentists. Crowns are, implants are, root canals are. Those things are big money for dentists. Dentures aren't that big of money for dentists, and they're a freaking hassle because you get sore spots. Your mouth is always changing, and dentures are tricky. There's a lot of providers in this world that just aren't experienced with dentures. There are a lot of dentists that have made one denture or a couple dentures in dental college, and that's all they ever did. They just are kind of winging it. So, and they're never making the dentures when you go to see them, hardly ever. I mean, there's an exception to every rule, but most of the time you're going to the dentist, he's taking your impressions, he's getting the measurements for your bite, he's picking a tooth color, he's sending it off to a lab, they're making the dentures, they're sending it back to him, and he's putting them in your mouth. And so when things are wrong, the dentist doesn't understand all of the things that happened when the dental lab made those dentures. So there's a disconnect. Even for me, when I had my son working in my office and, he would be making a denture and I would be delivering it to the patient or following up on that, denture that he made, or vice versa. I made a denture and he was following up with the patient on the denture that I made. He didn't make that denture. So he wasn't familiar with all of the intricacies of that denture. There's just, I'm not tooting my own horn. It's just there's something to be said about the person that is seeing the patient, taking the impressions, looking in the mouth, seeing how big the patient is, how small they are, the size of their mouth, the way their mouth moves, all of that. That is then making the denture, following up, doing the adjustments, doing all of that. I cannot tell you how many times I have seen a teeny, like little tiny patient who has had the biggest freaking gums that I have ever seen. I had a patient from Peru. She was about 4'8", and to this day, the biggest gums, biggest mouth I've ever seen. There's a piece of machinery, I guess you would call it, a contraption that we invest dentures in. It's called a denture flask. And that person's gums, their model of their mouth barely fit into that flask, and they were so teeny tiny and petite. So, if I were just to take that person's impression and send that out to a lab, that person making those dentures probably would have been putting humongous, big, masculine teeth in that denture, because they would be picturing, such big gums, a big, huge, tall, burly person. But in actuality, she was like 4'8" or 9. She was t tiny, like came up to, my chest. So there is a disconnect, and dentures are a hassle. They're a hassle. There's a lot of moving parts that are going on. When you're making a crown, I'm not a dentist, I'm just assuming. When you're making a crown, it's a fixed thing. It's cemented in place. Patient bites together, you put the occlusal paper in there, you get to see it in its permanent stationary place. To me, that cuts out a lot of guesswork because it's not moving around, it's attached, it's there permanently. But when you have dentures, those are moving around. There's soft tissues involved. The jaw is moving on the bottom all the time and grinding that lower denture against the upper denture. There's a lot of moving parts to dentures. There's a lot of moving gums, a lot of moving tissues, a lot of cheek attachments, all types of things that are involved with dentures. So it's a huge hassle for the dentist. So maybe these providers aren't telling you all of these things, and they're not telling you, boy, I had a fly on my nose, that, you need to come back. You need to come back and get adjustments. You need to come back and get relines and, probably several adjustments. Maybe some of them aren't telling you because they don't want to deal with it. I mean, that's all I do. And I always encourage my patients. I don't care if you come back 10 times. I don't care if you come back 20 times. I would like to do a tiny adjustment at a time so that we don't over adjust the denture and make it loose. But yeah, I think I've cracked the code. I think that it's just a hassle. And so, these providers are just giving you these dentures and being like, okay, have a great life. Take care. Bye. And they don't ever want to hear from you again because it's a pain in the ass. But who am I? Just a denturist. Maybe I'm wrong. What do you think?